Hi, folks. It's great to be here. I'm Dr. John Kuna, and this is my friend Renee, Arledge.
How are you? Very good to be here.
Renee is a Reiki master. She's Aroma Freedom Technique certified, and she's an ULA life coach. But Renee, maybe today we'll talk about something different as well. You were talking to me earlier before the show started about internal monitoring, or how did you phrase it?
I call it the internal narrative.
I love it.
So when I was bringing this up to you, I was thinking, when I work with anybody, whether we're using Reiki or Aroma Freedom or even the ULA life coaching, we always run into this internal narrative. And it's just that internal voice that you have, or that internal conversation that you have with yourself, telling you that you can't do something that you really want to do, or forcing you to do something that you don't want to do. So I'm sure that you run into that sort of thing.
Now, is this a blockage from ULA?
So in ULA, we could definitely see this as a blocker because we have, that internal narrative could be anger or guilt, self-sabotage, laziness, envy, or even what you're focusing on. So if you have an addictive personality, you get so focused on something you can't see the rest of your life. Or, you might have like a squirrel brain where you start something and then you stop, right? You never really finish anything, which could be a blocker too. So, it's definitely a blocker, and it can affect your life in tons of ways.
Right. Sometimes internal narratives are very quick and fast. They're like automatic thoughts.
Mm-hmm.
And sometimes they're really innocuous. They don't hurt people. Like if you're trying to get your stuff ready to leave for the office and you have your keys and you think, well, should I take my cell phone charger? Well, maybe I don't need it. Maybe there's one in the office. No, I better charge it. You have this internal dialogue that goes back and forth. But it's not always bad. Sometimes it's like a check and balance system. But many times the internal dialogue is inhibitory. Because if you want to say, you want to go in and go to a group, you want to participate in a meditation group. No, I can't. I'd never do that.
Mm-hmm.
There's really not even time for an automatic thought. There's just the I can't. And it's really some kind of internal mixture of anxiety, self-esteem issues, fear of failure. And it's just this glob of self-monitoring that says, no, I can't. That wouldn't work out for me.
Mm-hmm.
I'd be embarrassed. I'd be ashamed. If you take it apart, it's just this glob of inadequacy.